First is Prarthanasana, prayer pose, target chakras, Anahata, Agya. This pose is the starting pose for Surya Namaskara or the sun salutation poses. In Pranamasana, the palms are held together in the prayer pose. The word pranam has a Sanskrit root and it means to pay respect, and asana means a pose. Hence the name Pranamasana. Pranamasana is a common gesture used in India and many Eastern countries to show respect and a popular way to greet others, especially elders, seniors, gurus and guests. In India, the word for greeting is namaste, which means that I bow down to the self in you. The self or the jiva is said to be located at the heart center. Hence the palms are brought together touching one's own heart when bowing down and greeting others. This gesture with the hands is called pranmasana. Breathing normal. Awareness on the chest area. Benefits: this pose establishes a state of concentration and calmness in preparation for the exercise to be done. This asana gives balance to your body and eases your nervous system and body. Second is Tadasana, palm tree pose, target chakras, Muladhara, Swadhisthana, Manipura, Agya. Technique: breathing, the breath should be synchronized with the raising and lowering of the arms. Awareness, physical on the breathing, maintaining balance and the stretch of the whole body from top to bottom. Spiritual, initially on Mooladhara chakra to provide stability. Once balance is achieved, change to Agya, gazing tip of the nose or between the eyebrows or forward. Benefits: this asana develops physical and mental balance. The entire spine is stretched and loosened, helping to clear up congestion of the spinal nerves at the points where they emerge from the spinal column. Tadasana stretches the rectus abdominal muscles and the intestines and is useful during the first 6 months of pregnancy to keep the abdominal muscles and nerves toned. Practice note: those practitioners who have mastered Tadasana with the eyes open may try it with the eyes closed. 3. Tiryak Tadasana, bending palm tree pose, target chakras, as above. Technique: as above. 4. Katichakrasana, waist twisting pose, target chakras, Manipura, Anahata, Swadhisthana, Muladhara, Agya. Kati means waist, chakra means circular wheel. This asana is all about rotation of the waist. This is simplest of the twisting asanas, provides a good stretch to the waist to make it more flexible and supple. In this asana, your whole vertebral column is rotated on its own axis with the feet well grounded. Awareness on the breathing, hands and movements. Gazing Vam Parshva and Dakshina Parshva. Benefits: first is very good for office people to refresh. Second is removes fatigue, depression and minor aches. Third is provides relief from backache, constipation, indigestion and gas. Fourth is give flexibility to the spine and waist and strengthens the lower back. Fifth is opens up the neck and shoulders. Precautions: chronic spinal disorders. 5. Hastotnasana, hands raise pose, target chakras, Anahata, Vishuddhi, Agya. Breathing, inhale while straightening the body. Awareness on the stretch of the abdomen and expansion of the lungs. 6. Padhastasana, hand to feet, target chakras, Manipura, Muladhara, Swadhisthana, Agya, Sasarara. Breathing, exhale while performing the movement. Awareness on the pelvic region. 7. Virbhadrasana I, warrior pose I, target chakras, Manipura, Muladhara, Swadhisthana, Anahata, Agya. Contraindications and cautions: not to be performed by people suffering from high blood pressure and heart problems. Benefits: strengthens and stretches the legs and ankles, stretches the groins, chest and lungs, shoulders, stimulates abdominal organs, increases stamina, relieves backaches, especially through second trimester of pregnancy, beneficial for carpal tunnel syndrome, flat feet, infertility, osteoporosis, and sciatica. 8. Virbhadrasana 2, warrior 2, target chakras, Anahata, Vishuddhi, Swadhisthana, Agya. Contraindications and cautions. Not to be performed by people suffering from diarrhea and high blood pressure. Note, in neck problems, don't turn your head to look over the front hand, continue to look straight ahead with both sides of the neck lengthened evenly. 9. Virbhadrasana 3. Warrior 3. Target chakras, Manipura, Swadhisthana, Agya. Contraindications and cautions. Not to be performed by people suffering from high blood pressure. Benefits. Strengthens the ankles and legs, strengthens the shoulders and muscles of the back, tones the abdomen, improves balance and posture. 10th is Trikonsana, triangle pose, target chakras, Muladhara, Swadhisthana, Manipura, Anahata, Vishuddhi, Agya. Technique. First is stand straight. Separate your feet comfortably wide apart, about 31 halves to 4 feet. Second is turn your right foot out 90 degrees and left foot in by 15 degrees. Third is now align the center of your right heel with the center of your arch of left foot. Fourth is ensure that your feet are pressing the ground and the weight of your body is equally balanced on both the feet. Fifth is inhale deeply and as you exhale, bend your body to the right, downward from the hips, keeping the waist straight, allowing your left hand to come up in the air while your right hand comes down towards floor. Keep both arms in straight line. Sixth is rest your right hand on your shin, ankle, or the floor outside your right foot, whatever is possible without distorting the sides of the waist. Stretch your left arm toward the ceiling, in line with the tops of your shoulders. Keep your head in a neutral position or turn it to the left, eyes gazing softly at the left palm. Seventh is ascertain that your body is bent sideways and not backward or forward. Pelvis and chest are wide open. Eighth is stretch maximum and be steady. Keep taking in long deep breaths. With each exhalation, relax the body more and more. Just be with the body and the breath. Ninth is as you inhale, come up, bring your arms down to your sides and straighten your feet. 10th is repeat the same on the other side. Benefits. First is strengthens the legs, knees, ankles, arms and chest. Second is stretches and opens the hips, groins, hamstrings, calves, shoulders, chest and spine. Third is increases mental and physical equilibrium. Fourth is helps improve digestion. Fifth is reduces anxiety, stress, back pain and sciatica. Contraindications. Avoid doing this pose if you are suffering from migraine, diarrhea, low or high blood pressure, or neck and back injuries. Those with high blood pressure may do this pose, but without raising their hand overhead, as this may further raise the blood pressure. 11. Parivritta Trikonsana, revolved triangle pose, target chakras, Manipur, Swadhisthana, Muladhara, Anahata, Agya. Awareness on the twist and stretch of the body. Method. First is stand in Tadasana. Keep the feet together and hands on the sides with gaze forward with normal breathing. Second is move the feet about 3 to 4 feet away from each other. Third is inhale slowly and raise the arms to shoulder level so that they are parallel to the ground. Fourth is turn the right foot about 90 degrees to the body and the right foot about 45 degrees. Fourth is exhale partially and turn your torso to the right along to face the right foot. Sixth is exhale further and bend forward bringing the left hands towards the right foot. The left palms can be touching the right foot or the toes. It can also be placed on the floor next to the foot depending on your flexibility. Seventh is the right hand is raised straight, pointing to the sky with the fingers pointing upwards. Eighth is the gaze can be faced upwards looking at the raised hand. Ninth is in this final position you can take slow shallow breaths. Stay in the position for as long as you are comfortable. 10th is to release the pose, bring down the raised hand and simultaneously twist back to the front-facing position. Bring down the hands, placing it next to the body. 11th is repeat this on the left side as well. That will constitute one round of the practice. You may do as many rounds as desired. Benefits. First is Parivatta Trikonsana stretches the back and makes it flexible. Second is it gives a good stretch to the hamstring muscles, making it flexible over a period of time. Third is it tones the organs in the abdomen. Fourth is Parivatta Trikonsana improves digestion. Fifth is it is good for mild back pains. Sixth is it improves the sense of balance. Seventh is Parivatta Trikonsana is good for the flexibility of the spine. 12. Utkatsana, chair pose, target chakras, Manipura, Muladhara, Swadhisthana, Anahata, Agya. Breathing, breathe normally throughout the practice. Awareness on the twist and stretch of the body. Contraindications, not to be performed by people suffering from headache, insomnia, low blood pressure. Benefits, strengthens the ankles, thighs, calves, and spine, stretches shoulders and chest, and stimulates the abdominal organs, diaphragm, and heart, reduces flat feet. 13. Natarajasana, King Dancer pose, target chakras, Agya, Anahata, Muladhara. Breathing, breathe normally throughout the practice. Duration, up to 3 times on each side, holding each time for as long as possible. Awareness on maintaining balance. Benefits, this asana balances the nervous system, develops control of the body and mental concentration, and makes the legs supple. 14. Parivritta Utkatsana, revolved chair pose, target chakras, Manipura, Swadhisthana. Duration, practice once on each side. Discontinue the pose if any discomfort is experienced. Awareness on the strength, mobility and balance. Contraindications, not recommended for those suffering from insomnia, headache, or low blood pressure, or those with knee or ankle maladies and pregnant women. Benefits, increases circulation. Is alleged to stimulate digestion and boosts metabolism. Strengthens muscle. Lengthens the spine. Relieves stiffness in neck, shoulders, and spine. Variation, to deepen the pose, tee your arms out, with one hand on the ground and the other lifted upward. To deepen further, wrap your arms around your thighs for a full bind. 15. Vrikshasana, tree pose, target chakras, Agya, Anahata, Manipura, Swadhisthana, Muladhara. Breathing, dirgha or deep contraindications and cautions, not to be performed by people suffering from headache, insomnia, low blood pressure, high blood pressure, don't raise arms overhead. Benefits, strengthens thighs, calves, ankles, and spine, stretches the groins and inner thighs, chest and shoulders, improves sense of balance, relieves sciatica and reduces flat feet. 16. Garudasana, the eagle pose, target chakras, Muladhara, Swadhisthana, Anahata, Agya. Breathing, breathe normally throughout the practice. Duration, practice up to 3 rounds on each side. Awareness on maintaining balance while focusing on a fixed point. Benefits, Garudasana improves concentration, strengthens the muscles, tones the nerves and loosens the joints of the legs, arms, shoulders and is good for the upper back. It relieves sciatica, rheumatism and hydrocele. Contraindications, first is elbow injury. Second is knee injury. Third is ankle injury. Fourth is varicose veins in back of the knees, severe knee pain, arthritis. Technique, first is assume the standing position and focus the gaze on a fixed spot. Second is bend the right leg and twist it around the left leg. The right thigh should be in front of the left thigh and the top of the right foot should rest on the calf of the left leg. Third is bend the elbows and bring them in front of the chest. Twist the forearms around each other with the left elbow remaining below. Fourth is place the palms together to resemble an eagle's beak. Balance in this position for some time, then slowly bend the left knee and lower the body, keeping the back. Fifth is straight, until the elbows come down to the knees and the tip of the right big toe touches the floor. Keep the eyes focused on the fixed point. Sixth is hold the final position for as long as is comfortable, then raise the body and release the legs and arms. Relax with the eyes closed. Seventh is repeat with the legs and arms the opposite way around. Eighth is practice up to 3 rounds on each side. Breathe normally throughout the practice. Awareness, physical, on maintaining balance while lowering and raising the body. 17. Lasyasana, Parvati or backbend pose, target chakras, Muladhara, Swadhisthana and Agya breathing, deep breathings throughout the practice. Duration, for 10 breathings. Awareness, on maintaining balance while focusing on a fixed point. Modification, legs crossed, knees bent, one hand on the hip, one arm over the head drishti, urdhva or antara drishti, up to the sky. 18. Prasrita Padottanasana, widespread legs pose, target chakras, Muladhara, Swadhisthana, Manipura, Anahata, Agya, Sahasrara. Techniques, breathing, deep breathings throughout the practice. Duration, for 10 breathings. Awareness, on maintaining balance while focusing on a fixed point. Contraindications, serious back injury, abdominal hernia, disc herniation. This is a common lower back injury, high blood pressure, glaucoma, detached retina, or a shoulder or neck injury, ankle or groin injury. During the last month of pregnancy, any injury to your hips, knees, ankles, shoulders, neck, back, or head, migraine or sinus congestion, arthritis in your knees, hips, or shoulders, and fibromyalgia. Benefits, first is stretches your hamstrings and adductors, inner thighs. Second is a hip opener and also involves deep hip flexion. Third is helps find length and release for your spine and neck. Fourth, if you can bring your head to the ground or a stack of blocks, the pose helps calm your mind. Fifth, can help release tension in your spine, shoulders and upper back. Sixth, strengthens your quadriceps and hip flexors. Seventh, strengthens your core. Eighth, strengthens your calf muscles and ankle muscles. Ninth, your shoulders, chest, abdomen, hips, back, and legs all get a stretch during the practice of coming into and out of this pose, which helps increase the range of motion for all of these areas, leading to more flexibility. 10th Ashtanga Yoga links the 4 variations in a flow which is said to improve strength, balance, and flexibility. Variations: Prasrita Padottanasana B, Prasrita Padottanasana C, Prasrita Padottanasana D. 19. Utkatsana Konasana, Goddess Pose, target chakras, Muladhara, Swadhisthana, Agya. Goddess pose asks us to get in touch with the divine feminine within ourselves, balancing our strength and power with deep inner wisdom. Utkata Konasana is easy to perform and is excellent practice for women to widen and strengthen the uterus before and during pregnancy. Contraindications: Utkata Konasana should be avoided by those suffering from hip, ankle and knee injuries or any shoulder problems. When widening your legs, do not go beyond your limit. Benefits: 1. Utkata Konasana strengthens the hips, the lower back and the thigh muscles to it, widens the uterus before pregnancy and helps during pregnancy. 3. Utkata Konasana helps to broaden the chest and correct postural defects. 4. This asana massages the organs in the abdomen, particularly the kidneys, the ovaries, urinary system and the prostate gland. 5. Utkata Konasana enhances the functioning of organs in the thorax and improves respiration. 6. It energizes the body, relieves stress and gives a general sense of well-being. 7. It can relieve menstrual pain and cramps. Method: 1. Stand erect with the hands hanging freely on the sides. 2. Take the feet apart for about 3 to 4 feet depending on your comfort. 3. Turn your feet outwards with the toes pointing away from the body and the heels resting closer to the body. 4. Now bend your knees to the extent that you can go. Ideally, the thigh should become parallel to the ground. 5. Bring together both your palms in the Namaskara gesture and place it firmly touching the chest. Alternatively, other variations include placing the hands parallel to the ground with the palms facing upwards. 6. Pull your shoulders slightly backwards, pushing the chest forward. Hold your head high and gaze forward. 7. Breathe normally and deeply in this position. During exhalation, contract the abdomen and press the lower back down and feel the pressure on the hips and the tailbone, pulling the thighs backwards. Maintain this position for as long as you are comfortable. 8. To release the pose, first rotate the heels and make the toes to face forward. Simultaneously raise yourself up and make the knees straight. Bring down your hands and bring the feet together again. 20. Skandasana, the god of war or side lunge pose, target chakras, Muladhara, Swadhisthana, Manipura, Agya, Anahata. In Skandasana, Skanda represents a warrior's position during an attack and Asana means pose. This pose is dedicated to Kartikeya, who's the elder son of Lord Shiva and called the god of war. When the body comes in the side lunge position of Skandasana, it makes the practitioner looks like an attacker position on the battlefield. So, the asana got its name. It's also called pose of the war god. This is a common yoga pose that stretches your hips and hamstrings and helps build your core strength. It's a relatively simple lunge, making it perfect for beginners and regular practice. Contraindications: 1. Practitioners with a knee and ankle condition should avoid practicing this asana. 2. Menstruating women should refrain from doing skandasana. Pregnant women also refrain in the later trimester, and for initial, should consult a doctor before practice under the qualified yoga instructor. 3. Practitioners with the injury to the hamstring, groin, and hips do not practice this asana until recovered. Benefits: 1. Stretches your hamstrings and hip adductors to build core strength. 3. Improves balance. 4. Increases flexibility for more challenging poses. Technique: 1. Begin by coming into the Prasrita Padottanasana, standing straight, legs little wider than shoulder distance. 2. Come in half squat position on your right leg. 3. Turn your right foot outward, bend the right knee, and lean toward the right side while keeping the left leg straight. Shift your body weight slowly to the right leg. Flex your left foot and toes pointing upward. 4. Press the heel of the left foot and firm the right foot sole to deepen the stretch. This is the final position of the side lunge pose. 5. You can play with your arms to create variations of Skandasana. For the simplicity, make Anjali Mudra by the hand for accumulating concentration to stabilize the pose, or simply put them on the floor. 6. Hold here for few breaths, then come in the central position, first step, and shift the weight on another leg. 7. Follow this sequence of Skandasana, from left leg to center position and center to the right leg. Repeat. When done, stop in the center position and relax in Tadasana or transit into next asana. 21. Anjaneyasana, crescent moon pose, target chakras, Anahata, Agya, Vishuddhi, Manipura, Swadhisthana, Muladhara. Anjaneya asana, crescent lunge pose, is a deep stretch for the hip flexors and quadriceps. It can also be a little bit of a backbend if you want it to be. This asana is highly effective in activating and balancing the Anahata chakra, also for other chakras as mentioned above. Precautions and contraindications: be sure not to deepen the front knee quickly and listen to your body as you move. Make sure the front knee stays stacked over the ankle, even while deepening into the lunge to avoid overextending the knee joint's range of motion. If you notice any discomfort in that knee, be sure to stop and back off to avoid further pain and possible injury. Keep the back foot straight, do not let it sneak inward. This pose is not recommended if you have a knee or back injury. Note that, in most yoga poses with a bent knee, you should be careful not to bring your knee in front of your ankle since that is a vulnerable position for the knee. Anjaneyasana is one of the few poses where you are encouraged to deepen into the front shin past being perpendicular with the floor in order get a really deep hip stretch. This is safe because of the stability offered by having the back knee on the floor. Benefits: 1. Crescent lunge pose stretches the hip flexors and quadriceps. 2. This is a useful counter stretch for front load-bearing workouts such as cycling and running, as well as for those who sit much of the day. 3. It also opens the chest, shoulders, and torso. You can practice it to build your balance and stability. 4. As a heart opener, it is considered to be energizing. Method 1. From a low lunge, drop your back knee, the left knee, in this case, to the mat. If your knee is sensitive, you can place a blanket under your knee or double up your yoga mat for more cushioning. To bring your hands onto your right knee and your right knee directly over your right ankle. 3. Inhale and raise your arms above your head, keeping the arms in line with your ears. 4. To deepen into the lunge, press firmly into your feet as you allow your hips to shift forward. As you do, your left thigh comes closer to the floor. To support engagement and to avoid sinking into the joints, hug your inner thighs in towards one another to create adduction. 5. You may take the upper spine into a back bend if that feels comfortable. 6. Exhale to release the hands down. Reframe the front foot and release the pose. 7. Repeat on the left side. 22. Marjari Asana, cat-cow pose, target chakras, Swadhisthana, Manipura, Anahata, Vishuddhi, Muladhara, Agya. This asana improves the flexibility of the neck, shoulders and spine. It gently tones the female reproductive system, giving relief from menstrual cramps and leukorrhea. It may be safely practiced during pregnancy. Forceful contraction of the abdomen, however, should be avoided. Benefits: flexing and extending the spine can help improve circulation in the discs in your back. It's a basic motion, but one that can be enormously beneficial in supporting the back and easing pain and maintaining a healthy spine, especially if you spend a lot of time sitting. Cat-cow stretch can help you improve your posture and balance. It is also believed to be a good stress reliever and calming pose, since you link the movements with your breathing. Method: inhale and arch for cow pose, vertical bar, exhale, and round for cat pose, breathing, deep breathings throughout the practice. Awareness on movements of vertebrae column and chakras located in spine. Duration for 10 breathing. 23. Vyagrasana, tiger pose, target chakras, Manipura, Swadhisthana, Vishuddhi, Muladhara, Agya. Benefits: 1. Strengthens the muscles in the arms, knees and the thighs to opens the hips and brings about balance and flexibility. 3. Excess fat burns and tones the hips and thighs. 4. Digestive system improves and the muscles get toned. 5. Relieves stress around the lower back. 6. Tones the spinal nerves. 7. Reproductive organs get toned. 8. Opening of the chest works well for healing allergy related to asthma. 9. Great on the joints, hips, knees, ankles, shoulders, elbows, wrists and neck, helps in working on the movement of the joints. 10. A great chest opener, breathing, inhale leg up and exhale leg forward. Duration for 10 breathings. Awareness on movements of vertebrae column and chakras located in spine. Method 1. Assume the starting position for Marjariasana and look forward. 2. Relax the whole body. 3. Arching the back downwards. Straighten the right leg, stretching it up and back. 4. Bend the right knee. 5. Look up and bring the toes towards the back of the head. 6. Hold the breath for a few seconds in this position. 7. Straighten the right leg, bend the knee and swing the leg under the hips. 8. Simultaneously, arch the back up and bend the head down, bringing the knee towards the nose. The right foot should not touch the floor. 9. The thigh presses against the chest. 10. Hold for a few seconds while retaining the breath outside. Move the foot straight back and again stretch the leg. 11. Bend the knee and continue with the slow swinging movements. 12. After practicing on one side, relax in Marjariyasana. 13. Repeat with the other leg. 24. Parivritta Janu Shirsasana, revolved head to knee pose, target chakras, Manipura, Agya, Muladhara, Swadhisthana. Breathing, exhale and bend sideways. Stay there for 10 breathings, inhale and get up. Duration, practice once on each side. Discontinue the pose if any discomfort is experienced. Awareness on the twist and stretch of the body. Sequence, this asana should be practiced after forward and backward bending asanas. It is a twisting asana with a forward bend. Contraindications, pregnant women or people with back complaints. Benefits, this asana gives the same benefits as Paschimottanasana and Ardha Matsyendrasana with the added advantage that it stretches and massages each side of the abdomen and chest. It prepares the body for long hours of sitting in meditation asanas. 25. Janu Sirshasana, head to knee pose, target chakras, Muladhara, Swadhisthana, Manipura, Agya. Breathing, inhale in the starting position. Exhale while bending forward. Retain the breath outside if holding the final position for a short time. Breathe normally if holding the pose for longer. Inhale while returning to the starting position. Awareness, physical on the abdomen, relaxation of the back muscles or the slow breathing process. Sequence, this asana should precede or follow backward bending asanas such as Setuasana, Chakrasana, Bhujangasana or Matsyasana. Contraindications, people who suffer from slipped disc or sciatica should not practice Paschimottanasana. Benefits, this practice gives basically the same benefits as Paschimottanasana as well as loosening up the legs in preparation for meditation asanas. Practice note, also known as Ardha Paschimottanasana. It may be practiced before Paschimottanasana as a preparatory asana. 26. Paschimottanasana, head to knee pose, target chakras, Swadhisthana, Manipura, Muladhara, Agya. Breathing, inhale in the starting position. Exhale slowly while bending forward. Inhale in the static position. Exhale while bringing the trunk further towards the legs with the arms. Breathe slowly and deeply in the final position or retain the breath out if holding for a short duration. Inhale while returning to the starting position. Duration, beginners should perform up to 5 rounds, staying in the final position for only a short length of time. Adepts may maintain the final position for up to 5 minutes. Awareness on the abdomen, relaxation of the back muscles or the slow breathing process. Sequence, this asana should precede or follow backward bending asanas such as Setuasana, Chakrasana, Bhujangasana or Matsyasana. Contraindications, people who suffer from slipped disc or sciatica should not practice Paschimottanasana. Benefits, this asana stretches the hamstring muscles and increases flexibility in the hip joints. It tones and massages the entire abdominal and pelvic region including the liver, pancreas, spleen, kidneys and adrenal glands. It removes excess weight in this area and helps alleviate disorders of the urogenital system. It stimulates circulation to the nerves and muscles of the spine. It is used in yoga therapy for the management of prolapse, menstrual disorders, sluggish liver, diabetes, colitis, kidney complaints, bronchitis and eosinophilia.